Welcome to the foundational concepts of One Health. I'm Vijay Aldandi. I'm an infectious disease clinician specializing in transplant infectious diseases and also public health. For the last 3 decades, I have been working in the United States as well as India. In these sessions, I would like to introduce to you some concepts that I think have broad applications in health. So please join us as we explore these series of foundational concepts of One Health. Part 1 is salutogenesis. Salutogenesis requires a sense of coherence that has 3 components in it: comprehension, capacity, and capability. In other sessions, we have talked about comprehension and capacity. In this session, we will talk about capability. What is capability? Every human being desires freedom. Every human being fears loss of control, even above death. So the formation of health, salutogenesis, requires as the end goal capability, which is the ability to have a purposeful life with autonomy and dignity. Now, what is a purposeful life? A purposeful life really is very contextual. It depends on the individual. It depends on their cultural background. It depends on societal norms. And it depends on what else is going on. Nevertheless, it is impossible to have a purposeful life without health. And a purposeful life is also not possible without autonomy and dignity. So as healthcare providers, we really have to take the trouble to understand and analyze what it is that is important to that individual that we are partnering with. Not only just that individual, but that individual's purpose in life within the context of family and community and society at large. Obviously, as healthcare providers, we cannot be colluding in somebody's purpose in life if that is either unethical or immoral or is directed towards destruction and violence. So therefore, the purpose of life or a purposeful life with autonomy and dignity must be qualified. It must be consistent with basic human rights. It must be consistent with the values, the ethos, and the culture of humanity at large. But none of this is possible without enjoying good health. And therefore, the aim of comprehension and capacity towards building the ability to have a purposeful life with autonomy and dignity, that means capability, is linked inextricably to comprehension and capacity, social justice, and universal human values. All of this is possible only and only if we build a shared vision in a partnership. It cannot be a transactional relationship where the healthcare provider is the benefactor and healthcare consumer is merely a beneficiary. This means that every healthcare provider must exert themselves to have an appreciation of universal human values, culture, and be sensitive to cultural nuances of the people that we are working with in delivering good health. I hope that you will all embrace salutogenesis, and in particular the sense of coherence that requires comprehension, capacity, and capability.